Hey, good evening, everybody out there. I want to thank you for joining in for a live podcast today. I'm super excited on the Mental Health Warrior. I have a good friend of mine that's agreed to come on, Ms. Orstrom, Tori, and it's going to be a great show. But first, before we get started, I just want to say be sure to go out to Veterans Trash Talk and go out and watch all of our podcasts and see all of our shows. I have the Veteran Trash Talk t-shirt on right now, but like I always say, you can go out there and order your Veteran Trash Talk Mental Health Warrior t-shirt. It's out there. I flip it around. Of course, the green Mustang is hidden on the green screen, so it looks blue because of my background. And I always say it's a T-shirt that could save a life because on the back of it had the crisis text home number there. And so if you're in crisis, it is Suicide Prevention Month. So please always reach out to a family friend or somebody if they're having issues to go quiet. So I'm super excited to have Tori on. I'm not going to tell you too much about her. She has a great, awesome background. She is a veteran. I'm not going to tell her what service because it'll get Nick all spun up when he watches this.
Oh boy.
But with that, Tori, I'd like for you to go ahead and chime in. And if you wouldn't mind saying hi to everybody out there listening right now or going to listen later and tell us a little bit about yourself, and then we'll just kind of go from there.
Well, thank you so much. What a lovely introduction. So I'm Tori Osterholm, and I feel very fortunate to be part of this. I think you have an amazing message, Cliff, and I've known you since, we met when you were a keynote speaker.
Yep.
Um,
Maryland with
uh,
the Suicide
yeah,
Prevention.
Maryland National Guard. The state of Maryland actually
State of
sponsored
Maryland. Yeah.
that. And I remember I came in late. I had to find a place to sit, and they told, go to the front. And so I was like, oh, you don't want to be late and then go to the front. And then you were at the table, I think one table up.
Mm-hmm.
And so, I spot people in uniforms being a veteran. So I'm like looking, okay. And then you got up and you spoke, and I was just so blown away. And one of the things I just really loved about your presentation was I think everybody felt like you were talking directly to them. Like I thought I was in church, right? Like, oh,
Yeah.
he's just talking to me. And so that was really wonderful because I think, I know for sure what is so interesting and dynamic about your presentation is you're speaking to folks in their languages. So as a provider, you are speaking to me. As a person that may be struggling with even suicide ideation, I felt like you were speaking to them. And there were other people in the audience that were from so many different backgrounds.
Yeah.
And everyone, I was listening to their comments. I'm like, boy, he's really great. So I am a clinical social worker,
Mm-hmm.
an LCSWC. I guess that's the letters behind my name.
What's the C stand for? Clinician?
So, right. So it's right. It's as a clinician.
Ah,
So I'm independent. I pretty much can do anything but prescribe medication. I'm a graduate of Bryn Mawr, Graduate School of Social Work. So that's where the MSS, people always ask me, what's that? Yeah, so I'm very proud of that. I was actually trained in psychoanalysis. I don't know if anybody's doing that anymore, but that was really cool. And having said that, before that, my background was psychology. And honestly, I graduated with a degree in psychology because I looked up and realized I had all these credits. And I was like, I better graduate.
right.
I just found that I really loved how the mind worked. So then fast forward, or before that, I used the GI Bill to go to school. And I didn't really know anyone in mental health. And to be honest, I didn't really believe in it. I thought if you talk to people about bad things, they're going to feel bad and maybe do bad things. Um,
Yeah.
I didn't understand that. So it wasn't that I was taught stigma. I just thought get your stuff together and get on your way. And I wanted to go to school to be a psychologist. Oh, and then I had an internship at Hershey Medical Center, and that's where I met my first social worker. I didn't even know what a social worker was. And I found out that they talk, right? And they ask you questions, and they weren't doing tests. They were just asking questions. And I was like, what is that? And they said social work. Oh. So I stopped what I was doing, and I ended up going to college for it. and it's been extremely rewarding. So I think being a veteran of the United States Air Force, go ahead,
Okay.
start
I was
now.
gonna plug it in.
Here we go. And not being a clinician. I started off enlisted in the United States Air Force when I was 19 years old, and I was always part of a medical detachment, a medical unit. And then I was an intern at the VA center, the VA hospital. And at the time that I was, they got rid of all their social workers and they thought nurses can do it. We'll call it nursing case managers. And then they found out there's like, you know, social workers that can do that, right? Because we don't have to worry about, you know, all these other things that are more physical medicine. How about we combine the two? Oh, go figure. So then all of a sudden the VA was like, bring all the social workers back. But by that time I was in the private sector and I was doing non-social work jobs. I spent 5 years in law enforcement. I was on television with QVC. I was doing all these things, director of marketing. So social work, I really wasn't doing social work. And then figured I just had such a pain in my belly about helping veterans, helping military people. I was just seeing that the war kept going and people kept feeling hurt and detached and frustrated. And I just felt that I needed to go back and be powerful. I went into private practice and went full-time working at the VA and had contracts in private as a private therapist with Military One Source before you couldn't be a government employee and all this other stuff. And I would see people through that. That was cool. And then I did EAP with the Postal Service, and I never looked for one patient ever. I was getting flooded because my bio said that I worked with diverse populations. And I think in the area I worked in, there weren't a lot of people who look like me. And then smash it up a little because I was a veteran and a woman. It just check and check and check. And then word got around about, you know, what services I was providing. And I think being in the military taught me not to be afraid of getting dirty, you know, getting in there, getting deep with people. And I started saying the word suicide and watching how even other providers weren't saying it. And then remembering, if I say it, nah, I don't think it's going to do anything if I say it. I don't think I'm going to hurt anybody by just saying suicide. And then I just learned from an amazing mentor that I had at the VA. And she said, you know, no one used to say cancer. And now they have shirts and signs and marches and runs. And I thought, yeah, I'm going to say suicide because I'm going to talk to people and ask them, you know, I think about dying.
Well,
Are you thinking about dying?
You know, there for a long time, just like you brought up, you thought if you mentioned suicide, then somebody would just go off themselves because you said suicide, right? And then, you know, now that's not the case, right? That was an old way of thinking. You know, I know that that you did a lot of work with military and special forces guys, and along with working with you know, the men in blue and stuff like that, and you know, with the wars going on, I can imagine it was really hard because I think when I met you, you were at Fort Meade, if I remember right, working. You know, and the work you did there was amazing. And then you came and worked for the Guard for a while. But you know, being, you know, Suicide Awareness Month and everything, and I wanted you to come on, and I've been trying to get you to come on my show for what, 8 months now.
Yes, I'm a terrible friend. I'm a great
You're
clinician.
busy,
I'm
friend.
a terrible friend.
You're a busy person.
Yeah.
But you know, well, you know, and I appreciate it. And it was important for me to have you come on during Suicide Awareness Month. And we're going to get in talking about something that I deal with this week, or starting last week. And I think a lot of veterans out there, especially ones with PTSD, suffer through this from time to time. And I think it's a common issue that a lot of people have. So for a lot of people who don't know, you should know if you've been watching my podcast, I'm a suicide survivor. But also I have issues in my back because I got injured in Iraq. Well, I get Botox shots in my back. And then when those shots start wearing off, because it's where it's at in my C4 through C7, I get strange nerve pains in my chest, right? And when it first happened, I thought I was having a heart attack. And I went to went to the doctor and he says, no, you're not having a heart attack. And so with the Botox, it keeps that from occurring, but when it wears off, it happens. And so you guys know that if you see my post on Facebook, that the Army's 10 milers coming up. So I've been training for it. And so last Thursday, I went and did a hard uphill run. I ran hills, right? And I ran it hard. And so I got back and I was just doing my regular recovery things. And I turned my head and all of a sudden I get this strange pain in my chest. And it's something that I haven't had for a while. And so that sets me on a mental free for all, right? Because I have TBI and ADHD. And so now I'm running 10 million scenarios through my head. Oh, I'm having a heart attack. Maybe I pushed a clot. I'm doing all these stupid things. And then I started getting really depressed, right? Because from Thursday, all the rest of the day, Thursday night, of course, I didn't sleep. I woke up in the middle of the night, right, in a panic, right? And then, Friday comes. And so I try to stop my way of thinking and try to not think about that, right? But I didn't get my Botox till Friday morning. And Botox isn't instantaneous. It takes weeks for it to start taking effect. Things will subside. And so one thing I did Friday morning is I couldn't go to yoga. This was last Friday. And so because of my appointment, so I went and had Botox done on my back, and she hit some major trigger points when she was giving it to me, right? And so as I'm back home by myself, right, I start running these stupid scenarios through my head again. Oh, what's going on with me? I'm having health problems, blah, blah, blah. Maybe I pushed myself too hard. And then the doctor wants me to go get an MRI and other stuff. So I had to make an appointment with my primary care to get that done because she's out of network, my spine doctor. So Saturday I go to the car show. And if you saw the post, I won best of show with my Mustang for the modified class. There's like 400 cars at the car show. It's pretty amazing. We were shocked that we won. But all day Friday, because I'm around people and I'm visiting, I didn't have any issues. Didn't think about it. Right? We get home Saturday night and I'm once again, Lloyd's in bed or whatever, and I'm by myself and I start having those thoughts come in again. Right. And the negative thoughts, something's going on with you. Life's going too good. Somebody always says this, and with PTSD, I have this issue. And I think it goes back to when I was refratted, that when things are going too good, I'm just waiting for something bad to happen. Right. And so then, because I won a car show, now I think something bad's going to happen. And that's a hard train of thought to break yourself up. And so as the days went on, of course, talking with you, Tori, and things, and you had texted me and told me, hey, just, kind of refocus and do something. But I just kind of, with you and with your background, because I know a lot of people with PTSD probably can imagine what I was going through. And I'm sure many of them probably go through the same thing. I had to try to break that mental negative road I was going down. And some of the tools that I used in the past wasn't working, so then I had to think of something new. And, as much as I talk about mental health, being a mental health warrior and stuff, I was at a loss. And that's when I text you, because, I was at a loss. And so, if somebody's like me is going through that, and they're not, if you have a medical issue, please go to the hospital or whatever. I wasn't. Mine was solely nerve pain. And I know that. My brain knows that. But for whatever reason, my brain wasn't saying, it kept me going down that negative path. And I would say, yes, I'm breaking it, but I haven't broke that yet. Because every now and then it tries to slip back in. I say that all the time. PTSD is like a sniper. He wants to wait around in the ground and hide out. And when things start going wonky in your brain, he jumps in there and starts adding on and adding on and adding on. And so if somebody's listening, Tori, and they're going through the same thing, and we don't have to go into deep analysis, but what would be some easy tools that somebody could use, or from your experience that they could do to try to break that way of thinking? And one thing I did is I stopped sitting at my house alone in a room. I just got up and did something. Whether it was going outside and walking up and down the street, whether it was going out and doing something on the car, just something to get my mind to think about something else.
Right. And I was, and I love that you shared it that way. Right. So there's two things that happened for me, the way I sort of handle things. I think the fact that you recognize, like, that's what happens with good treatment, right? So you have good days, you have bad days. And I would always say, PTSD is like, one of those relatives, like the drunk uncle that everybody tolerates and you really can't stand him and you wish he didn't like marry into the family. And if he's in the family, you're trying to figure out how to cut him off. And he's like that guy, that annoying friend. It doesn't have to be a guy. I want you to get all this bad feedback, but it could just be anybody that's annoying.
You won't get no feedback here.
Yeah, well,
it's trash talk. Come on.
Oh, okay. Now we're in it. So I think it's like, I would always tell people, you're afraid of it, right? And so good treatment and good therapy and getting messy and getting dirty is that you recognize it, right? And you're just like, yeah, that could kick my behind. So recognize that, right? Be willing to understand that. When I work with special operators, like I'm basically saying to someone, today you suck as a superhero, right? Like you do. You're running around, flying around. You've got a ripped up cape that you can't see because that's what PTSD is. I'm fine. And everybody's like, yeah, dude, not so much. And my whole thing in learning and going to a good therapist that's going to talk you a mess, walk it with you, get dirty with you, hold it for a little when you need it. You can come back, you know where it is. PTSD doesn't go anywhere. That's the thing. Other things, it can go away, but know that without treatment, that's that nasty Uncle Teddy that wants to roll up on Thanksgiving and have projectile vomiting on a turkey. Like that's who it is, right? So when you get treatment, you understand, like, it could come to the door, right? And when you have good boundaries, it's like timeshare. Thanks for the free stuff. See you on your way. Know where you are. Give me my free gifts. Roll out. Don't commit. I think that's the difference of it, that you recognize that it's there and you learn to manage it, and you have to learn to trust yourself. But in the immediate sense, when, things happen, when you have good treatment, you have good people around you, you have people you can talk to, informal, familial resources, people, like you called me, I call you, we work it out. For someone just to jog the mind for even a second to go, hey, I got it. What are you doing right now? Right? Don't lay in it. How do I lay in it? I'm laying in it, right? It's like, yeah, you're laying in it, So what could you do anything but what you're doing right now? I like to keep it really simple, right? So, I love yoga. I love other people doing yoga, but somehow when I'm standing there doing all that, I'm stressed out. Like, yoga stresses me out. I'm sorry. I don't know it enough to like go into the deep dog undercover wet rug move. I don't know, but I'm stressed out because I'm waiting for the next thing. Right.
Yeah.
So sometimes being forced to not think makes me overthink.
Yeah.
So sometimes I need to run it out. I need to do a high octane situation. So, and then there's times where I have to do nothing. And I got to be okay with doing nothing. But when I tell other people, like with you, well, what are you doing? Yeah, I was just kind of thinking about it. And you want to go, so don't think. So it's like, well, what could you do? Even if you have to do it, you have to walk the dog. Yeah. Did you? No. So go walk the dog.
Yeah.
And talk to yourself a little. That's okay. Right? I feel like crap right now. You could even make it into a song. Recognize that, right? And it's okay. It's okay to leave it there for a minute. It's going to be there, but maybe you come back and you can manage it. I really hope I'm providing any kind of good input here. Everybody is so different, right? Everybody.
I think just recognizing that it's okay to have that thought, right? Because it was, even though it was something similar, and I know my body, right? Because I work out all the time and I'm a healthy guy.
Yeah.
And I knew it. I knew what was going on, but my brain still went there. Right. And so you said, I recognized it and do something different to change your way of thinking. And even if it's not something that we're talking about, maybe a little depressed, or maybe something in your life's not going the way you think it should. And now you're starting to dwell on that. Now you're sitting in that room dwelling on it, or having a drink, or doing this. You need to do something to stop the dwell. Right.
Yeah. And if you can't do that on your own, that's where
anything like get up and go walk the dog, or go do something.
Yeah.
you know,
And it's real, right? It's
don't kick
real.
Uncle Tom out of the house.
Yeah. Yeah. I always say Uncle Teddy. I don't have
Yeah.
an Uncle Teddy, by the way.
Yeah. Oh, okay.
No, I don't. But that comes from somebody else's story. Like, my drunk Uncle Teddy shows up and ruins every Thanksgiving. So I was like,
Right.
huh, it's kind of like PTSD, right?
Right.
Like, boo, here I am. But I think it's real. It's really real. Like, the pain you were having, your heart rate going up, that's real. That's
Yeah.
not you're thinking about it. That's real.
Yeah.
Right.
Yeah, because my normal resting heart rate's 59 or 56 between 59. It was 71 that day, which for a lot of people for me, that's high, right? Because that's 20, almost 20 some odd beats higher than normal. Not quite 20. I can't do math right now. But anyway, so it was higher than normal. But
right.
As I started changing my way of thinking, the resting heart rate went right back down to normal 10 hours later. But it took me 10 hours to get to that point, you know.
Yeah, because you were hijacked, right? I mean, that's part of PTSD, right?
Yeah.
And, we call that, in a fancy way, that's like the amygdala hijacking. So when that happens, right, we become hypo or hyper. Yeah. Right. So it's not like people think, oh, PTSD, you're going to throw a table. No, sometimes you just sit down and don't move.
Yeah.
Sometimes you're quiet like a little church mouse. You're just nothing. You're just not engaging. You're isolating. That's the other side. Right. Mm-hmm. And anybody hears that, and it doesn't have to be like, I'm really trying to avoid rhetoric right now, because I think it has to be a practical application to understand that you're not at your baseline. You're not at your happy place. And you know what? That's enough. That's enough. You don't need to be interviewed. So then what are your symptoms? How about what's going on? Yeah. I think that's what I do, right? What's going on? And then you can see someone's physical discomfort.
You just jump right into it. You don't.
I do. Sometimes I sit quietly though. When somebody's scared, sometimes I'm scared with them.
Analyzing,
and we're just scared. Yeah. Sometimes I got nothing. I'm just like, woo, that's kicking your butt. Like I can see it. And I think that's validating, right? Like if someone I know personally is off sides, I'm not going to go, well, you're off sides. I'm going to go, wow, that is, how are you feeling? Yeah. I don't know. And if it's someone that I know that struggles with that, and with TBI, sometimes you have that poor impulse control. So if you throw in a prior suicide attempt, and then you might have a history of suicide ideation. My role now, if I'm a clinician, is to go, all right, let's remove the option of that suicide thought. Let's get rid of that option. There's a lot of places we can go on this crazy today journey. I'm not calling somebody crazy. I'm saying this sucks. It's crazy. Yeah. It's not good. I don't feel safe, right? That's what it is. Yeah. How do we reel it in where you aren't afraid of you? Yeah. And part of you is PTSD. Yeah. Right? It's part of you. Yeah. Right? Love it, hate it, kiss it, smack it. It's all part of who we are. And
well, I mean, a great example is, okay, so I have white coat syndrome, right? And for people who don't know what that is, that means if I go to the doctor, like I'm going to go Thursday, I already know my blood pressure is going to be high. Because I stress out about going to the doctor days before I go. And I don't know why I do. But when I was in the military, I would go into the clinic or whatever and then get in an argument with an E4 over the fact that they just took my blood pressure and it was high and they want to put me on medicine, right? And I refused it. But when I go home and do the home blood pressure test, it's normal, right? And so it's crazy, but I already know. But now that I've retired, I still have that. I haven't been able to break that. Now, if I go to the doctor, like my spine doctor, they could care less what my blood pressure is because they already know it. So they just go in and take it and whatever. And then when I was going to the TBI clinic, I had to go there for 6 months before my blood pressure was normal. And then if the clinician was different that did the blood, it was high. But then Dr. Brown kind of figured all that out and it was fine. But I mean, that's just something that's so silly and stupid.
But it's not though, right?
It's not. But to me, it's just one of those things. It's a quirk I have. I'm like, look, but whatever. It is what it is. And I may walk in there Thursday.
Right? It is what it is.
It is what it is.
Yeah, it is what it is. like I said, when I made that comment, which I thought I was going to be fired because I was at Walter Reed when I said it,
Yeah.
but for me to sit
You're a
with
rock star. They
a
wouldn't
Navy
fire you.
SEAL, I know, I was always wondering when that was going to happen.
Yeah.
And it never did.
That means
But
you're doing your job right? If you
well,
always think you're gonna get
right.
fired,
So it matters who's hearing it, matters who's taking it in. So if this person wasn't open to receive the fact that I also said at the end, I said, I'm fighting back tears. And that doesn't happen often to trip me up. But I said, I'm afraid you're going to die. I'm definitely afraid you're going to die. And I just wanted to tell you that my mouthing off like that, saying you suck as a superhero, that there's one thing you're doing, right? The bravado, the I got it. You can't expect someone to go in to a burning building and go, yeah, great idea, right? I'm going to throw some grenades and I'm going to run that way. Yeah. Nobody that's rational thinks that way. But when you're trained to suppress anything that looks like a pause,
right?
How am I going to say, all right, you don't know me from a can of paint. I'll do my like therapeutic, deeper voice. Maybe it's soothing. Maybe it's weird. I don't know. And then say, I want you to tell me all your business, even though you've been trained to keep your mouth shut. Yeah. All I'm saying is what I see. And then where do we go from there? I don't expect anybody to give me like super secrets, right? Is it pertinent to what I need to do to keep you safe? And that's my goal. Yeah. And if you learn a whole bunch of cool stuff, great. But I was so afraid. And I'm just like, this guy is just telling me all this cool stuff that he's been doing. And I was like, whoa, whoa, whoa. Because I'm not trying to get extracted in the middle of the night. I don't know if I need to know specifics.
Helicopters flying over.
Right. I need to go home, or maybe I need to go to daycare. Like, I need to live today. I got nothing. So I think that was it. My belly, I was having, my blood pressure probably went up. And, I was reacting to that kind of stimulus of, whoa. And I've worked in ERs. I've done all kinds of cool stuff, military stuff. Yeah. But what gets me is when someone is just hanging on and my brain is like firing. How do I get them? How do I shrink them down? How do I stick them in my pocket and save them forever? The reality is they're right in front of me right now. Yeah. When I had a female soldier, she was like, aren't you afraid of, she was so afraid of her. She wanted me to be afraid of her. I was afraid of everything. I said, I'm afraid of everything. You're scaring me. We're both scared. Let's just sit here. Because I knew if she was in front of me, she was safe because I was going to make sure of that. But I had to figure out what the after looked like. And everybody talks like you, Cliff. It's just so silly. 1 minute, I'm grocery shopping. The next, I feel like there's going to be a bomb.
Yeah.
And I go, I don't know if that's so silly because that's real for you.
Yeah.
Right. So that's part of normalizing what doesn't make sense.
Yeah.
Right. But it does, though. It's about fear. That's for me. I'm not trying to water it down. I'm trying to say that it is fear. Like, you have amazing skills. Your journey has been amazing, right?
Yeah.
Absolutely amazing. You've done so much work and you continue to do the work. It's because you respect, your Uncle Teddy. You understand, you got to respect PTSD. Don't play small.
Yeah.
Don't, because that knowing, understanding, trusting, recognizing, respect it, right? Really, PTSD got some ranks sometimes. We need to be aware. Don't act like you don't see it.
Right.
Because it's going to get you if you don't respect it. And it can be nothing, right? You go months with nothing, years with nothing.
Oh, yeah.
And then here it comes.
Yeah.
And it could never come back. I don't know. Everybody's so different. But when it comes, I hate to use the word hate, but I gotta. I just don't want someone to go down that dark hole and think that's the norm, right? Okay, here comes PTSD. I'm about to get my butt kicked. I'm trying not to swear right now, but that's real. That's real.
It is real.
And I always want to, like, let's just slow it down, take away that fear. And that's what with you, I was like, oh, that's ridiculous. I was like, okay, so no to that, right? And then some of it is validating it. Do you need to go? Maybe you need to go to the doctor and get checked out. Maybe you need someone to say, you're in great shape. You are so healthy. what's going on,
Yeah.
right? Like
Yeah.
physically, great. Psychologically,
All screwed up.
look at this. You know,
It's a hot mess
let's,
in here.
let's just back it up. But that's what it is. You're being hijacked. You
Yeah.
know, your brain, and then your brain is fighting for position, right?
Mhm.
So that's where I come in. So let's sort it out. Let's talk about it.
Yeah.
And sometimes, you know, talk isn't enough. And then there's other things you can do, right?
Yeah.
Some folks need medication. Sometimes everything is so perfect. You're like going to therapy, you're taking your medication, nothing
Mhm.
in your life seems to be awful. And then boo. So you got to still wrap it up with
Yeah.
it's always, it always comes from somewhere. It never just comes from nowhere. I always say that, like, and it could be something small, right?
Yeah.
The color of paint, silly things.
Well, I
But
talk about a stick snapping or the wind blowing a certain way or a leaf
right,
floating in the wind or something anything can trigger your PTSD that brings you back to that moment. And I say this all the time. It's just like the most vivid dream you've ever had or lived. And it happens again, and I've had a stressful, it's Suicide Prevention Month. I just did the live show on 9/11, last weekend with Jack or weekend before last, 9/11.
I worry about you. This is a big month. See,
Yeah.
he's watching the connection.
Yeah.
This is a month of you.
Yeah.
Right? This is you getting booked, double booked, triple booked. People want to talk to you, but the other side of it is you need to go in your man cave or wherever you go and do whatever to get away from all of us asking you for stuff, right?
Well, that's what I like about running and working out. That's my decompression moment. That's where Cliff goes and just lets everything go. But when I'm unable to do that, right? And this is how PTSD works, it just starts creeping back in again.
Yeah.
And then you start that spiral. And that's one of the things I was grateful when you decided to come on the podcast, because I knew with your experience and stuff, and I'm truly going to have you back on the show, and I would love for you to come back on the show. But
Thank you.
being Suicide Awareness Month, and we've kind of put a focus on it. We always want to say, hey, go call your buddy and your friend. Well, I say that every podcast, whether it's
Yes.
October, November, of course, December, I'm sensitive because that's when I attempted. But really, the hardest months for suicide, and correct me if I'm wrong, is in the spring. Because a lot of people with the change, it's the change that stresses people out.
It's anything, right? I mean, with you, you're retired and that's new for you,
Yeah.
right? I don't know if it's been even a year, but
1 year. August
right.
31st, 1 year.
It's hard. Whoever, I've known, soldiers who had PTSD from being close to someone that something happened physically to, and it didn't happen to them, but it still happened to them, right? Because it affected them.
Yeah.
So again, I can come on here with all kinds of statistics and all of that. I just know that data is people, right?
Yeah.
So one person is enough for me. So I don't have to talk to 100 people that have PTSD. I can talk to one person, and I'm learning, they're learning, and we're processing safety. So I know I get a lot of feedback from my peers too. Tori, it's not that simple. You know what? Life and living, right? You live, you die. There's a whole bunch of cool stuff in between. There's some crazy stuff in between, but I don't want anybody rushing to the end on me.
Right.
I sound like a detective from 1950. Not on my watch, see? Because I don't see anything but solution.
Right.
I don't. I'm smiling, not because I think suicide is funny or happy, but I think it's important. We got to talk about it. We got to hear the stories. We got to share. Your story is amazing, but I've always said to you, right?
Yeah.
Okay, so like when you tell your story, what do you do that night?
Yeah.
Right? Because you're reliving it. You're there all day. And everybody's like, woo, Cliff Bowman. Great. What are you doing when it's quiet and it's just you?
Yeah.
With you.
Yeah.
That is what I pay attention to, right? That's the support staff over here, not in a clinical way, in an informal way, just saying you gotta watch yourself. I'm on sabbatical right now. It's my own, okay? Because I just wanted a minute to see some cool stuff, see some good stuff, and not be interrupted. And I don't want to be part of anybody else's story right now. I
Right.
just want to be part of my own story. That's pretty much the healthiest thing in the world that I've done for myself in forever.
I think for a lot of people who are in the military, that's hard to do, right? So even now that I've been retired, when I travel, it took me a while just to realize I don't have to rush back, or I don't have to go here, go there, or be there at a certain time, unless I'm speaking or something like that. But what I'm saying
Right.
is if I go and take a trip to California or wherever, it's okay to stay an extra day or two or a week
Yeah, right.
to go travel around and look at the site, because then you
Imagine
can go
that.
back to work.
Imagine that.
And that is a hard thing. You think it's silly,
It is.
because
Well, how about
every
you
day
could
for
plan
me is
your own trip?
Saturday.
You could plan
But
your
yeah,
own
it's
trip
hard to,
and you
yeah,
don't have to you don't have to get permission to be on leave,
yeah,
right?
yeah,
You don't have to deal with that government system of awesome traveling.
right,
Um, you can do whatever you want. You could get
yeah,
there and decide you don't even want to go back that way. You want to
right,
go another way. It's
yeah,
so simple how when you're part of such a mega system and you're trained to not think just individually, it's kind of hard. Then we're, as therapists, we're saying, think about the self. Okay, but if you've been trained to not think about yourself, and shame to you if you just think about yourself,
right,
again, it's a different way of reprogramming and introducing your brain to something happy. And if you're someone struggling with depression, it's really hard to sit in the happy because you're
mhm,
waiting, you're waiting, you're waiting, and here it
yeah,
comes. And, and it's the same thing with PTSD. I recognize you. I see you. You can't hide from me, but I'm going over here to pick flowers and dance a jig. I'll be back for you, PTSD, in
yeah,
just a few moments, and I just think life is good, Cliff, right? It's good
yeah,
because we're living
yeah,
and we're alive. And I love that you call me. I love when anyone calls me that I
yeah,
care about. And I don't really go into, so Cliff, how are we feeling today? It's just like, hey, what's up?
yeah. Yeah, you always like that. I mean, even if I call you at midnight, which I don't think I've ever called you at midnight, but I knew if I
I
did,
don't
you
even know if
you
I'd
would
be
answer the phone.
alarmed. I would be like, oh, I guess
Yeah,
he's in Korea or doing
yeah,
something. Like,
somewhere
it's
else.
not
Yeah,
my
he forgot.
immediate sense. I don't
He
see you
forgot
as
what
sick. I
time
don't
zone
see
it is.
anyone as sick. I just want to
Yeah,
know what's up,
yeah,
you know?
yeah. That's true. Well, hey, Tori, I want to say I appreciate you coming on my show, and I hope you come back on my show. Well, but
I hope
October's
I didn't
Oc-
ruin your show.
no, no,
How about
October is
that?
Mental Health Awareness Month, right? Isn't October Mental Health? So let's get you on the schedule. Come back in October, and maybe we can do a live show. We'll do a pre-recorded show. But I appreciate you coming on. I appreciate you as a friend, but I also appreciate you as the service you did to the nation and being a veteran, but
Oh,
also
thank
what you
you.
do as a LCSW. I mean, the work you do with both soldiers and civilians and others, to help people like me and others, make it through the day. Right. And so you make it
Yes.
through the day, and then you go to the next day, and then you go to the next day, and then you go to the next day. You're right.
Yeah.
And sometimes you got to go back 3 days, and then you go to the next day. So you just keep moving forward. And I know that's hard to
Yeah.
do sometimes, but it's great. And we're gonna go ahead and end it here. But do you have any last words before we go ahead and sign off here? The great Tory wisdom.
Yeah, I don't know about all that. But I just want to say thank you. It comes with great humility. But I want to say that I'm selfish too. So when I help someone, it just makes me feel like I'm contributing, and that's the military person in me that I did good work. Um,
Mhm.
and so I just felt called to this, that I'm pretty good at it because I love it. And
Yeah,
I just love helping people. And you know what? I too struggle with, everything like everybody else. I'm normal.
yeah, yeah,
And I think that's real. So I just like people to know that if it's your stuff, then it's your stuff. It doesn't have to, you know, I'm
yeah.
not a suicide um, survivor. I'm not a survivor of suicide, but that doesn't mean that I can't help someone
Right.
that's having a hard time. I'm just trying to shorten that road. Let's not make that the normal go-to.
Yeah,
Let's just make it a place we recognize that we don't want to go to.
yeah. That's I really appreciate it. That's really good words to say to end the show. And I just want to say, hey, to everybody out there listening and who's going to listen to this podcast later, if you're Suicide Prevention Month, but if you're having that road or having those thoughts that we talked about today, please take to heart and call a friend or a family member, or maybe go get therapy, because every now and then we need a tune up. You know, I got old cars and I go to car shows, and every now and then you got to change a spark plug or get that fuel filter change or something, you know, just to kind of get yourself back to running again. But hey, please, thanks for tuning in. Please go out to VeteranTrashTalk.com, watch all of our shows. You go out to the merchandise store, and get one of our t-shirts. All proceeds go to continue the shows and continue helping veterans. If you use the promo code Charlie Bravo 2022, you can save 10% on your total order. But thanks again. You guys have a great day and the rest of your week.